My dear friends, I am Dr. Omkar Prasad Baidya. Today I will be discussing about the risk factors of colorectal carcinoma, or also known as colon cancer. Now, what is colon or colorectal carcinoma? Colorectal carcinoma is a cancer of the colon or rectum. So, colon is important part of the gastrointestinal tract. It forms the large intestine, and there are various parts of colon like ascending colon, descending colon, sigmoid colon, and and rectum is the part through which feces come out or stool comes out. And the cancer of this colon and rectum together we call it colorectal carcinomas. And one of the important cause of colon cancer is because of polyps. So there are various types of polyps. One is adenomatous polyps, another one is inflammatory and hyperplastic polyps. Now adenomatous polyps has a higher risk of converting into cancer, whereas inflammatory and hyperplastic polyps are mostly benign and they don't are converted into colorectal carcinoma. Now, to understand the colorectal carcinoma, we should know that there are various types of cancer that occur in colon and rectum or colorectal area, like adenomatous cancer is 80 to 90% or nearly 86% of all the cancers, and more than 90% also according to some literature are adenomatous polyps or adenomatous cancer. And other cancers are the other type of cancers may be sarcoma, lymphoma, gastrointestinal stromal tumor, and also carcinoid syndrome. So these are the various types of cancer that can occur in colorectal area. The most common is adenomatous cancer, and it occurs because of polyps. Now we will discuss today what are the various risks of colorectal carcinoma. So number one important risk of colorectal carcinoma is age. Now, as the age advances or when a person gradually become older, the risk of colorectal carcinoma also increases. So it has been found that it is very much common among patients more than 50 years of age. So age is important factor which increase the risk of colorectal carcinoma. Next one is family history of colorectal carcinoma. If there is a family history or any brothers or father or any relative suffering from colorectal carcinoma, it is important risk factor that other members of the family can also get colorectal carcinoma. So family history may be unmodifiable risk factor for colorectal carcinoma. Next important risk factor is inflammatory bowel disease. Now what is inflammatory bowel disease? There are two types of inflammatory bowel disease. These are ulcerative colitis and Crohn's disease. Now ulcerative colitis and Crohn's disease, they are together known as inflammatory bowel disease, and inflammatory bowel disease is one of the important risk factor for getting colorectal carcinoma. So ulcerative colitis and Crohn's disease, this is because of inflammation in the rectum, which if it remain in the rectum for a long time can leads to colorectal carcinoma. So those patients who are suffering from ulcerative colitis and Crohn's disease should be very much cautious or should consult with the physician, and doctor must take these cases, that is ulcerative colitis and Crohn's disease, so as to prevent the risk of getting colorectal carcinoma in future. Then some genetic syndrome like familial adenomatous polyposis or familial polyps is a genetic inherited condition where the person can have some polyps in the colon. So it is one of the important risk factor for development of colorectal carcinoma, that is familial adenomatous polyp. So it is one of the important genetic syndrome which may be associated with increased risk of having colorectal carcinoma. Another modifiable risk factors is physical exercise, lack of physical exercise. So those persons who are not doing regular physical exercise, or those who are avoiding physical activity or remaining physically inactive for longer time, they have a higher risk of suffering from colorectal carcinoma. Another important risk factor is diet, especially diet which is low in fruits and vegetables. So diet which is less or low in fruits and vegetables increase the risk of colorectal carcinoma. Besides, high fat diet or western diet and low fiber diet and diet rich in processed meats or red meats increase the risk of colorectal carcinoma. So number one is a diet which is low in fruits and vegetables increase the risk of colorectal carcinoma, and a diet which is rich in high fat content or high cholesterol diet or high fat diet and low fiber diet. And at the same time, some of the special diet like red meats and processed meats, diet containing red meats and processed meats are also increases the risk of colorectal carcinoma in future. So we should always increase the fruits and vegetables in our diet, and we should increase the fiber content of our diet, and at the same time we should avoid animal meat, especially red meat like lamb, then mutton, then beef, pork. We should avoid all those meats, and especially grilled meats we can avoid, because once the food undergo processing, then it increases the carcinogenicity of the meat. Besides, overweight and obesity may be important risk factor for development of colorectal carcinoma. Now, when a person is overweight, it increases the risk of various diseases like hypertension, diabetes, cardiovascular illness, stroke, and even certain cancers. And it has been found that even obesity or overweight, if it is not maintained and associated with physical inactivity and very poor diet or diet rich in fat content and so many things, and low fiber or red meat, increase the risk of getting colorectal carcinoma in future. Alcohol consumption has been found to be associated with increased colorectal carcinoma. Alcohol is not only bad for colorectal carcinoma, it is also bad for heart. It is also increase the risk of other cancers. It increase the risk of fatty liver, alcoholic liver disease, hepatocellular carcinoma, and so on. So alcohol also increase the risk of colorectal carcinoma, and thus those who are alcoholics, they must be advised to avoid alcoholism, and especially mild to moderate alcoholism does not hamper much, but those who are doing heavy regular alcoholism with toxic dose, for them the risk of getting colorectal carcinoma is very much high. Besides, tobacco use is an important risk factor along with smoking. Smoking or tobacco can be important risk factor which increase the risk of colorectal carcinoma. Smoking and tobacco use is a modifiable risk factor. Smoking increase the risk of many cancers. Increase the risk of lung cancer, it increase the risk of kidney cancer, then breast cancer, and many other cancers is caused by smoking, even nasopharyngeal cancer also, but it also increase the risk of colorectal carcinoma. Smoking contains lots of radioactive substance and toxic substance, carcinogen, that can irritate the colorectal mucosa and leads to formation of polyp and ultimately leads to cancer. Then another important risk factor is especially diet which are rich in red meats, grilled meats, fry meats, increase the risk of colorectal carcinoma. So red meats means animal meats like pork, mutton, then beef, lamb. We should avoid all those red meats, because red meats, when they are grilled or fried, they increase the risk of colorectal carcinoma. Besides, low level of vitamin D may be associated with colorectal carcinoma. So person should always resort to sunbath, but over sunbath may also leads to skin cancer. So or please take supplements of vitamin D, proper nutrition or vitamin D through our diets, or mild to moderate sun exposure is very much important, as lack of vitamin D may be associated with colorectal carcinoma. Besides, some inherited syndromes like Page-Jaeger syndrome, then polyp in the colon. Polyps in the colon may be one of the important risk factors. So those persons who are prone to develop polyps in the colon are highly at risk in development of colorectal carcinoma. So Page-Jaeger syndrome is one of them. Page-Jaeger syndrome is responsible for polyps in the colon, then which may increase the risk of colorectal carcinoma, and it also involves various other syndromes in the body. Besides, racial and ethnic background also play an important role. It has been found that colorectal carcinoma is very much common in blacks and especially African American. Means among the black it is very much common. Type 2 diabetes mellitus also increase the risk of certain cancers and colorectal carcinoma is among it. Type 2 diabetes mellitus is associated with hypercholesterolemia and fat dyslipidemia, which increase the risk of other diseases like cardiovascular disease, hypertension, microvascular complication. But beside that, it also increases the risk of colorectal cancer. And type 2 diabetes mellitus can be also associated with obesity. So that may be another important risk factor for development of colorectal carcinoma. Besides, according to some studies, those subjects who are working as night shift workers, those workers who are working in night shifts also are at higher risk to develop colorectal carcinoma in future. That is because those who are working in night shift, they may have high level of melatonin in their body, and this melatonin secretion may be associated with cancer development in some, especially colorectal carcinoma in some individuals. So some more study we need to concentrate on this area, whether night shift working atmosphere increase the risk of colorectal carcinoma or not. But according to some study, those person working in night shift, because of increased melatonin level or altered melatonin secretion, they are prone to develop colorectal carcinoma. Besides, it has been found that those patients who are suffering from testicular cancer and are taking radiotherapy or have taken radiotherapy for prostate cancer may develop colorectal carcinoma in future. So in those persons who are suffering from or who has suffered from testicular cancer or prostate cancer, they can ultimately lead to the increased risk of colorectal carcinoma in future. Besides, low level of calcium may be important factor. It has been found that diet low in calcium or lack of calcium level or low calcium level in blood and associated with low deficiency of vitamin D is maybe associated with colorectal carcinoma. Besides, some other inherited conditions like familial adenomatous polyps, then Gardner syndrome, juvenile polyposis syndrome, then Link syndrome, then Page-Jaeger syndrome, Tarkos syndrome. So these are various syndromes which are associated with colonic polyps, and polyps are the pathological state or abnormal situations which is responsible for converting into colorectal carcinoma in future. That's why various inherited conditions which are associated with colonic polyps may lead to colorectal carcinoma in future. That's why these inherited situations or conditions are at higher risk of development of colorectal carcinoma. Besides adenomatous polyps, out of all the polyps, adenomatous polyps or those who are having adenomatous polyps, they are at higher risk because they ultimately leads to adenocarcinoma of the colorectal area or leads to the adenocarcinoma of the colon. And adenomatous polyp is one of the important common cause of development of colorectal carcinoma, and these adenomatous polyps can be diagnosed by colonoscopy. So colonoscopy is always advised for early diagnosis and resection of polyps also. Then in case the colonoscopy diagnose presence of adenomatous polyps or some polyps, polypectomy can be done in early stage of detection of the colorectal carcinoma so as to totally stop the or prevent the development of colorectal carcinoma. So adenomatous polyps or presence of adenomatous polyps in the colons of some individuals can be one of the important risk factors for development of colorectal carcinoma. Besides, those persons who are already suffering from other cancers like ovarian cancer, uterine cancer, they can develop colorectal carcinoma in later life. So some cancers like ovarian cancer, uterine cancers in female especially can also increase the risk of colorectal carcinoma in future. And when it comes to race, especially blacks are highly prone to development of colorectal carcinoma. So these are the various important risk factors of colorectal carcinoma. Out of these, dietary factor is very much important. Smoking, alcoholism may be important risk factor. Poor diet, especially diet low in fiber, high in sugar, high fat, high red meat, high saturated fat increase the risk of colorectal carcinoma. Beside familial adenomatous polyps or very presence of adenomatous polyps in the colon increase the risk of development of colorectal carcinoma in future. Colorectal carcinoma mainly produced from polyps. The polyps undergo dysplasia with time, and which ultimately leads to cancer or carcinoma. And polyps are present in the polyps if present should be removed in early stage of development of the colorectal carcinoma, so as to prevent the disease. Besides some rare disease like familial adenomatous polyps, then Page-Jaeger syndrome, all those things or all those this syndrome may be associated with colorectal carcinoma development in future.